And first, tell me about your story when it came to the pandemic. When you first got the news of us having to shelter in place, what were your feelings and emotions? And were you taking the virus serious, or was it just kind of something you saw on the news?
It was for me. It was something I just saw on the news. It was since they were giving us numbers, and then I would actually just think about the population in California, and then doing the math. It was like the percentage is very low at this moment, so there's nothing to really worry about. It was that's how I felt for me.
Yeah, and for me, it was I really didn't take it seriously either, especially like when I was seeing on the news just folks kind of rushing in to get supplies. And I remember even like at work just saying like, oh, this whatever, I don't take this seriously, and like really making a joke of it. And so yeah, for me, I felt like it was just something that was sort of blown out of proportion.
And when did that set change to this is something that's really happening in our community?
For me, it was more of the actual numbers again back to them, just seeing the rise and then just seeing everyone else out there, being cautious about, going to the store, wearing masks, and all the rules getting implemented throughout the state. So that's when I became a little more serious and more aware, and took precautions as well.
Yeah, for me, it was I think when we all got kind of sent home from our workplaces and had this sort of shelter in place when Sacramento County sort of mandated it. And then I think for me, it was when it really hit me was when I remember we went to Target and we were trying to find toilet paper, and just seeing like how empty the shelves were, and then sitting in line 6 feet away from other folks and wearing masks. Like, I think that's when it really hit me, like, oh wow, okay, this is really happening.
And for folks at home that don't know, why are you guys in separate rooms right now?
Now we're in separate rooms since I was actually diagnosed with the COVID, and we were, during the time I was actually going through symptoms, we were actually still in the same bedroom, and then so we were just told to quarantine ourselves from each other. So
Yeah, so he got diagnosed. He had symptoms for about a week, but he didn't get tested until about a week after his symptoms. And it was probably about during that week that I started to isolate just based off of doctor's orders, like since we weren't sure. And then when he got admitted into the hospital, I've been in a separate room from where he was at. And so we're just trying to take all of the precautions just so that he definitely has it. I'm not sure if I have it at this point. And so my first test came out negative. My doctor thinks it might be a false negative. And so I got retested. And so I still need to isolate from him, and I'm still on his quarantine has ended, but my quarantine still is continuing through it's 14 days after his quarantine ends.
Mario, walk me through what were your symptoms? Where do you think maybe you contracted the coronavirus, or is it still unknown?
No, actually, it was through a family member that was here in town from Southern California, and he didn't know he had it. But so I had a little gathering. It was, it was Father's Day weekend, so we decided to have a little barbecue out on a Friday, and then about Sunday I started having symptoms, which were um, diarrhea, like really bad diarrhea, and as well as like high temperatures and about 103 temperatures. And we didn't find out till he went back home, and then about Tuesday, he called my mom, and then it was like he has COVID. And then I told her, well, I'm actually having really bad symptoms right now. So that's when we decided to actually call our medical providers to get tested. And Mike tested and couldn't get tested until about Saturday of that same week, of which was the next week after. So throughout that whole week, I was just, trying to stay hydrated, but anything that went in just came back out. It was really intense because it was like, no sleep, 24 hours, just of those bad symptoms. And when the time came to actually have the test done, I we drove there, and then by that time, I was having really bad time breathing, so I couldn't. I barely walked to the car. I barely stood up, and I was really uncomfortable. And then I was just. So we get to the Kaiser, and they give me the test, and then once I get the test, my wife, she actually decided to call the advising nurse from Kaiser to tell her what my symptoms were. And she advised that we actually go back to the ER that day, that same day. So once I get to the ER, she drops me off. They don't allow anyone to go inside with you. So I barely made it in through the doors and onto the counter to actually um, get get inside the hospital. So once I'm there, they decide to actually take me to one of the rooms. It was pretty faster than normal when you go to the ER. So they take me, and then they plug me into oxygen, which seemed to help at that moment. And it was like about 10 liters, I think, that they were giving me at that time. So it helped with the breathing, but I was still having trouble even talking to them. And once you're there, it's like everyone, you're inside that room, and you're by yourself. Like, I think even the nurses and doctors are, they're taking really good precautions about going inside a room with someone with the COVID, even though they didn't know I had the COVID, but it was evident. So they tested me again inside there and drew blood, and so you have like about 8 people on you, like right away, just putting your IV, giving you, trying to get all the test done right away once you're inside there. And so they come back and tell me that I have bacterial pneumonia and pneumonia due to the COVID. So it was like 2 to 3 different types of pneumonia that I had, which was the main reason why I couldn't breathe at the time. So they go in and they do all the testing. And then I wait about 6 hours before I actually get admitted to the hospital to actually get into a room. And once in the room, they start giving you antibiotics or whatnot, mainly for the pneumonia that I had. But there's nothing they could give you for the actual COVID, for the virus itself, for that moment. And then once I'm there, I'm actually having high fevers, sweating, and like I'm really cold, and it's just all over the place basically. And I'm still having a hard time breathing as well. And then so I'm there for about a week, and because they do provide with 2 types of options for treatments that they have, and those treatments are actually they're not FDA approved yet, and they do tell you, they notify you that they're not, but some of them have been working, some uh, or they have worked on some people and not on other people. One of them is steroids, and the other one is just a treatment that kills viruses, basically. Um, but again, they're not FDA approved, so I prompted for the one that killed the virus. So they gave me that for about 5 days, and it's a really strong. Um, I don't know if it's an antibiotic, but I don't know what the term is. But so I'm on that for about 5 days, and after those 5 days, I'm urinating. My urine, it's like different color. It's like a darker, really dark color. So by the 5th day, they gave me that. And at the 5th day, after treatment is done, about 6 hours after, I believe, start having the fever again. And I'm really cold. I'm really sweaty. And so they decide to actually take me and do a CAT scan. And then from the CAT scan, I immediately get taken to the ICU. And once I'm in the ICU, um, I um, I I had to go to the bathroom, and what came out the rear end was blood. So once that blood comes in, they determine that I'm actually bleeding from the inside. So I have internal bleeding going on, and they couldn't figure out as far as uh, where it was coming from. It took them quite a while for them to figure that out. And so they do a procedure. While I'm in the procedure, then I go into um, what they call it. It's pretty much a coma because I couldn't breathe on my own. So I go into a coma for about 2 days, and then they have me on this respiratory machine for 2 days, and after that, I mean, I guess they figure out what it was that it was causing the bleeding. So it was like an artery or something inside. That was a rupture, I believe. They never
It
told
was like
me why or what caused it or any of that. And but by that time, my breathing was really bad. Throughout that whole time period, I lost about 30 pounds, which was deteriorating on my body. So when I came out the hospital, and they try to get you out as soon as they see that you're a little bit better, just because of the fact that the numbers during that time were peaking. So there was a lot more people that were trying to get into that room, using the ICU or whatnot, or using the machines and the equipment. So the numbers were really high. So I believe I got released really fast. But although they sent me home with oxygen, they provided us with oxygen for, the time that I needed it, and a walker and everything that I needed, basically, like if I was at the hospital, but yet at home, and they're still monitoring me as we speak. But it took me about 2 weeks to actually recover from just actually talking, because my breathing, it was just really bad. So that's what the.
And now that you're at home, did they say when you need to get retested to see if you have been cleared of COVID, or are you still having symptoms?
Um, I don't have any symptoms as far as COVID. Like, my temperatures are fine. Like I said, I'm being monitored, every day. My wife here does all my vitals in the morning, and but as far as the testing goes, they pretty much said that if anything, I could get tested like in September, but to self quarantine myself for 3 weeks. And I've been doing a lot of some research, and just the fact that their testings, they're really scarce on them. So I believe that's why they can't just throw away, like, oh, we're gonna retest you, But once they know that you have it, so they pretty much tell you that the virus actually stays in you with for a period of time, which is 2 to 3 weeks.
Mhm.
So it's best to actually self-quarantine for that amount of time. But as far as me being exposed, I've been with, like about a month now with, I mean, but I don't know if I still have it. So just because of the fact that I can't be tested.
Yeah, they said it could be dormant for a while. So while he's not exhibiting any symptoms, he could still potentially have it, but it's just not. I guess it's kind of like the dormant version of it. And so I think that's another reason why they're waiting to retest.
My next question is for you. How's it been as a wife, seeing your husband go through this, not being able to be in there with him, and then also coming home and having to play caregiver, essentially?
Yeah, it's been tough, very tough. I think it was really difficult just not being able to be in the hospital with him by his side and not being able to really ask the questions of the doctor, the nurses, like in real time, they would call me and give me updates, but it was kind of pretty random, I would be calling a lot, and it was definitely like an emotional roller coaster because it seemed like one minute he was progressing and doing okay, and the next minute I would get a call from a doctor just letting me know that his life was in danger, and so and then I was quarantining at home as well, so I couldn't have like my mom or my relatives here with me to comfort me during that time, and so it's been definitely. I think definitely just overwhelming, super emotional, and I wouldn't wish this upon anyone. I think the other thing that really has come to light for me as well is just the disparities that occur when it comes to this pandemic. Like we're really fortunate to have family members close by who do drop-offs for us. We're fortunate that I can be on leave from work and still get paid, and that we have means to have, delivery services drop off supplies and food to us because we can't leave our house. And just like thinking about other folks who are essential workers and don't have those luxuries, or don't have the means to be able to do that. I think that's really come to light for me as well. Just the disparities that occur when you're facing this pandemic, and so, yeah, it's been incredibly emotional, an incredibly emotional ride to just not be by my husband's side, not being able to be there to support him emotionally, as well.
And you kind of touched on my next question when it comes to disparities. Both of you are people of color, and we have been hit by this virus more than any other. What would you tell people who look like us, who are going through this, or also don't understand how serious this is right now?
Well, on my side, it's been, I'm a very analytical person, so I watch groups of people a lot, and I've seen how they actually react to the pandemic, and most of them don't take it very serious at all. What I would say to them, it's an actual thing that it's happening throughout the state, in the country, in the world, and those numbers, although they might seem small because of the populations within the country, they still exist. And then the thing is that this thing propagates. Like I didn't even have to hug the person that exposed me to the virus. I didn't, I didn't really do much in order to contract the virus, and it's an actual thing. So you don't know if when people have it, so you might as well take those precautions and take this serious, because I'm a testimony of the fact that I was there, and like I said, it's a really rough time. I mean, I'm just talking about it like as if just telling the story now, but being there, it's really tough. It's really a rough time. I mean, it'll make the even the manly and just break down. And the fact is that I'm fortunate that I came out of it, because a lot of people can't say the same thing. They're gone because of this virus.
Right. Yeah, for me, I definitely echo that. I think that, once we did notice it was more serious, we were definitely more cautious. And then everything got lifted and we thought like, okay, yeah, like family barbecue. And I think that happens a lot with communities of color as well. Like we're very collective in our ways. And so I think, you think like, oh, it's safe because it's your family, it's cool. And I think it's just, be cautious. I know that we're communities of color, we're the ones at the forefront of, as far as it comes to being essential workers, and things of that nature. And so we're definitely more exposed than others. And so my advice is just, take all the precautions that you can, wear the mask, wash your hands, wear gloves if you can, take whatever precautions you can take, and I think the biggest thing is like what I'm seeing as well for especially young people of color is like kind of like the idea of missing out on the social life, and it's like that social life will be there down the road, but this pandemic can take away that, can take that completely away from you if you're faced with it, and so I think just really just being cautious and thinking twice. And I hope that through us sharing our story, other folks will think twice before they, kind of put themselves out there.
And I forgot to ask about employment. This happened, it sounds like Father's Day was in July, right? And so we're now creeping into August. This is a lot of time to be out of work. How is it going with your employers and dealing with that avenue of it?
For me, I'm a full-time student as well as an audio engineer, but that just stopped just because I do live concert reinforcement, and that just literally stopped because of the same thing, because of COVID. So there isn't concerts going on at all. So that for me that's over, and I'm just waiting for the next school semester to start doing it online.
Yeah, and for me, I'm very fortunate that I was already, sort of working from home, and so I've been able to go out on leave. So there is some leave that the state provides for folks who are facing COVID. So that's been helpful for me as well. I'm also able to use some of my own, accrued leave that I have while taking care of my husband. I think that's the other thing that for folks who, I think one of your questions earlier was like individuals who are facing it. I think that's some folks, which is very, very common in communities of colors, like we're very like hush hush about things. We don't want to put our business out there, right? And so I think it's important, like if you're feeling symptoms, to get the help, seek the help. There are a lot of like programs and avenues for folks. I know folks feel like, I might lose income, and there are programs out there. The state is trying to work hard to provide relief for folks who are facing this pandemic as well. And so I would say like reach out and get that help where you can.
And when it comes, we talked about it a little earlier before the interview began, but can you let viewers know, have you been tested? Are you worried that you're going to contract it from having to, you're quarantining your home, but still, the air ducts, and it takes hardly anything to catch this virus?
Yeah, I feel very nervous, especially living through this. I'm like, I definitely feel more nervous for him just because, sorry, I'm probably gonna get emotional. He went through so much, already. And I feel like I can't sleep at night. I like literally wake up almost every hour to check on him because we're in different rooms, just like kind of peek in the room to make sure he's okay, he's breathing, just because it was such a roller coaster. Like he was fine one minute and the next minute he's in ICU, and so, or it looked like he was progressing in a healthy way, and then something else takes sort of a dip in his health. And so I feel definitely concerned because I've heard of cases of folks who are super sick, get better, and then they get it again. So I feel more concerned for him when he probably feels more concerned for me. But of him contracting it again. So I did get tested. I got tested the day before I took him to the ER, and my test came up negative. So my doctor thought it was a false negative, just because the next day I was so close in the same car with him, even though we were wearing masks, we were so close to each other. And I had like very minor symptoms. But now I got retested again this week. And I'm just waiting for my results at this point just to see whether or not I have it.
And Mario, this is a question for you. When do you think this is going to be over? What is next for you? What does the rest of your recovery plan look like?
My recovery, as far as from this point on, it's actually just trying to, because I still have trouble breathing. I'm still, but it's not from my oxygen. My oxygen levels are fine, but it's just trying to recondition my body to actually, keep on walking and just walking mainly. It's a movement. It like I said, it takes a toll like on your whole body. Like, so I had to, just lifting my arms over my head. It was just actually getting out of bed, using a walker, and now I'm not using the walker. So sequentially, like, I'm actually progressing like every day. Like, the more I do things, the more everything comes back. So that's what the recovery looks like.
And that makes me happy to hear. And congratulations on those steps towards recovery. What does quarantine look like for you? Is it just you in a room by yourself? Do you have a TV? Like, how are you staying entertained? Or
so the first week when I came out, first or 2 weeks, when I came out the hospital, I was just inside the room. We have a TV there, and it's just social media, I guess. That's everyone's entertainment nowadays. So just going on online and reading and stuff like that. And now that I'm able to come back down to the living room, then I sit here, and then I just started 2 days ago going outside to the backyard just to, catch that sun, the vitamin D or whatnot. So yeah, it's a progress. But yeah, I'm really happy that I'm alive mainly, and that I know that I'm gonna continue to try to reach my goals and the everyday goals, and long-term goals, so that I'm actually going to be able to do that. And sadly, many people can't say the same thing, but, just for those people that are out there and, thinking this isn't real, it's a fact. So.
Is there anything else that I didn't add that you want to add to this interview about what you guys have gone through as a couple? And what you weren't expecting to happen to you during this?
Well, for me, it's been a month and some change since I've been close to my wife. We've been together for about 12 years or 13, something like that. So it's been a long time.
Oh, you better get it right now.
Yeah, so we're very affectionate, and I haven't, kiss my wife, or I tell her that I love her every day in the morning, thank her for everything that she does every day for me, and just, but the closeness is not, that's kind of frustrating a bit, just because we've been living together for so long, and it's sad at times, but you gotta remain strong, and hope that all this is over for us, and then just continue to live life.
Yeah, that's been really tough, especially since, I wasn't able to be there to hold his hand when he was in the hospital. And so it's been difficult not just being able to hug him and, and just be close to him. I think that's been really hard. And we're newlyweds technically, right? We've been married about a year now.
Yeah.
And so I think that's been really tough. I think on the positive side, I think you know, this is just really showed us how strong we can be, how strong we can be as a couple, how strong we can be as individuals, because this could really emotionally completely break you, you know. I think like you're asking about the quarantine situation. I think it's already hard enough for some folks, like just being indoors or staying home constantly, you know, that add everything else to that, you know, it's it can be really emotionally draining. And so I think that's really made us, I think, both stronger. And we hope that, you know, he can continue to get stronger every day, and just continue to be on the road to recovery. And now moving forward, or looking forward, just being even more cautious and super cautious with everything that we're doing, all of our lifetime activities. I think this is gonna stay with us for the rest of our lives. And so you know, that means that that's gonna that's gonna end up affecting everything we do, and I think every decision that we make as well.